Good evening. This is Dr. Paul. Once again, thank you very much for tuning to our channel today. Today, I want to talk a few minutes about brain metastasis. Before I go further, I request you to visit our website at www.usmlevideos.net, and that is www.usmlevideos.net. And we have been posting videos on a daily basis. Request you to take some time to visit us. So let me give you some most important points for brain metastasis. Brain metastasis is a very feared complication of cancer. And in fact, that is the most common intracranial neoplasm in the brain. Because now many cancer patients are surviving longer than as it was before. Today we are seeing many people with brain metastasis. The other thing is we have a very diagnostic imaging studies, very sophisticated, like MRI with contrast, which can see very minutely sized neoplasms. That's why today we have this increased incidence of brain metastasis because we can see them more and more often. Now, the most important thing you need to remember is which type of cancer they go to the brain. On the top of the list is lung cancer. So the lung cancer, it goes to the brain than any other type of cancers. You need to remember that point. Now, it's a challenging situation for the physician, and it's also emotionally debilitating to the patients. Imagine if somebody comes to you and tells you that they found a brain tumor on your films, like MRI or CT scan. How devastating that could be. So that's what happens to these patients. They become emotionally destabilized, and it will be a devastating blow to their psyche. So these patients, they need special care. Now, most of these tumors, they go to the brain through blood, arterial circulation. As I said, the lung cancer, it goes through the blood. And some cancers like GI tumors or pelvic tumors, they use the Batson's venous plexus to go to the brain. So it can go through arterial circulation or venous circulation. Ultimately they reach the brain, and most of these metastatic tumors, they lie in the junction between the white matter and gray matter. So if you see between the junction between the white matter and gray matter, you should suspect metastatic tumors. So many of these cancers, they start through the lung. You see, arterial blood, it goes through the lungs before reaching the brain. So it picks up many of these embolic tumors from the lung, and the lesions, they go to the brain. They may end up in cerebrum or cerebellum or brainstem, but ultimately that is how they go into the brain. So remember that this arterial circulation can ultimately take these things. So lung tumor, then comes breast tumor. So you see the frequency of these tumors. Now, as I said, many people are developing these problems, but let us see some numbers. Lung cancer is on the top of the list, like 72%. Then comes breast cancer. Then comes colon cancer, and finally melanoma. So those are the top four. So you say lung, breast, colon, and melanoma. So you should remember that. And the prognosis is poor. Once metastasis happens, prognosis is poor. Most of these patients, the best of them, die between 18 to 24 months. Now, if you think in terms of sex, the lung cancer is the most common cancer that metastasizes to brain in male patients, whereas in women it is breast cancer. But as you can see around, women are smoking like crazy. So in the next few years, actually, in both male and female patients, lung cancer might be the most common cancer that metastasizes to the brain. So you need to remember what type of cancers go to the brain and how they present in the brain and what is the age. Most of these patients are like between 35 and to 70 years, and also how they go to the brain. As I said, arterial and venous circulations, they develop. And how do these patients present? What are the most common symptoms? Many symptoms result from increased intracranial pressure, resulting in headache, vomiting, confusion, lethargy, focal irritation, or destruction of neurons, and that results in visual field defects and aphasia, ataxia, focal seizures, and focal neurological signs of deficits. So the symptoms and signs can vary depending upon where the metastatic tumor ultimately end up in the brain. So if it ends up in brainstem, it produces certain symptoms, and if it ends up in the cerebrum, it ends up in producing different kinds of symptoms. Ultimately, it depends on which particular area of the brain is ultimately affected by the metastatic tumor. So the symptoms and signs are basically depends on those things. Now diagnosis. How do you diagnose? These are many CT scans with or without contrast, MRI with or without contrast, radiography, ultrasonography. All these things are good, but the best imaging study is MRI with contrast. Remember that. MRI with contrast is the best imaging study to find brain tumors, the metastatic brain tumors. And this treatment depends again, there is no golden rule on how to treat a metastatic brain tumor. It depends on patient's clinical situation, what type of the primaries he has, what is the size of the tumor he has, and all those things play an important role in deciding the treatment. Sometimes radiotherapy, sometimes chemotherapy, sometimes surgery, sometimes radio frequency ablation. All kinds of treatments come. Sometimes just um, some hospice. You can't do anything about these patients, unfortunately. So that's about brain metastasis. Please visit our website at www.usmlevideos.net, and I also encourage you to visit our website at www.usmlevideos.net and our blogs, and you can find many other videos which are very important, and we only discuss most important points. Those of you who are taking USMLE clinical skills examination, I recommend USMLE Smasher. This book has like 70 most important cases you see in the clinical skills examination, and they are presented with the doctor patient real-time conversation method, and I strongly recommend this book, and thousands of people all over the world reading this book and passing their examination without spending thousands of dollars on expensive courses. So USMLE Smasher, it's available on Xlibris, Amazon, and Barnes Noble, and I recommend you to get this book and pass your examination by following just a few wise methods using some mnemonics and well-established tips. Thank you. This is Dr. Paul. Thank you very much.